Like many people, cancer was always something I had heard about, but never thought I'd have until one day I did. For the past 5 years, it's something that's been constantly on my mind. Since joining WNCT, I've taken you, our viewers, behind the scenes to some of the dermatologist appointments I've had, but this time was a little bit different. I want to warn you, some of the pictures you're about to see may be hard to look at. I was an invincible 23-year-old. Getting a master's degree in journalism and following my dream to become a TV reporter. But on December 26, 2012, everything changed.
You have type 1 skin, which means that you have really no protection from the sun.
I was diagnosed with skin cancer. I had probably had it for years, unknowingly allowing it to spread across my entire right lower eyelid. Over the coming months, I had my lower eyelid cut off and then rebuilt over 4 surgeries. This is what it looks like today. Ever since then, regular dermatologist visits have become part of my life.
Mr. Birch.
How are you?
How's it going?
But now 27 years old, the word cancer is being brought up again, now for a second time. During a routine skin check, Dr. Drury Armistead discovered precancerous cells on my face that had a pretty good chance of developing into squamous cell carcinoma. To take care of the problem, I'd undergo a treatment called blue light or photodynamic therapy.
This will pick up things you and I don't even know are there.
Fast forward 2 months, and I was back for treatment. They painted my face with an acidic medication.
Any cell that has the medication inside the cell, when it interacts with the light, it goes like popcorn.
After an hour and a half of waiting, it was time for the blue light.
Doing okay? It burns.
It felt like hours, but after 16 minutes, the light was turned off.
You really got surprisingly bad down here.
The bumps that I'm starting to see now, is that stuff?
Yeah, that stuff.
So that's already zapped?
Yeah, that stuff's starting to happen to you.
For the next several days, my face burned, blistered, and then peeled. But it was worth it if the precancerous cells had died.
I was diagnosed probably when I was 26.
Stories like mine are becoming all too common among young people.
It felt like somebody had just knocked the wind out of me.
Jennifer Berg also battled skin cancer. Hers was on her face and was removed through Mohs surgery.
They cut down the side of my face until about the end of my nose, and then cut from one corner of my eye to the other. Just being in the sun pretty much all day, every day. I never wore sunscreen.
But 31-year-old Brad Coleman did. Despite that, this young father has a growing count of skin cancers he's had removed.
7 or 8. You feel yourself sinking in your seat a little bit, especially at the age that I was.
The rates of basal and squamous cell skin cancers are so high it's nearly impossible for national data to be collected. But the National Cancer Institute does track melanoma cases, which have skyrocketed, increasing from 7.9 cases per 100,000 people in 1975 to more than 25 cases per 100,000 people in 2014.
I think more people are aware of it, but sadly, not a lot of people are doing any more to prevent it.
Many of those people not being proactive are young. The melanoma rates among those ages 20 to 49 have nearly doubled since 1975, increasing to more than 14 cases per 100,000 people.
I think the biggest thing is to become proactive more than reactive.
Coleman, Berg, and myself were the lucky ones. We caught it in time, but far too many others aren't so lucky. When we did that interview with Dr. Armistead, he said he had already diagnosed 10 cases of skin cancer that day. He says awareness without action and protection is simply not enough. Josh Birch, 90 Your Side.